Somewhere out there, a retiree is paying an extra $75 a month for the rest of their life because of one decision they made years ago, and they still don't know it happened. It's not a scam, and it's not a mistake by their insurance company. It's a Medicare penalty, and once it's added to your bill, in most cases, it never comes off. By the end of this video, you'll understand exactly what Parts A, B, C, and D cover, what they cost in 2026, and the specific mistake that creates this permanent penalty, including the real math on how much it adds up to over a retirement. This isn't personalized advice, but it's the foundation you need to ask the right questions. Let's orient ourselves first. Medicare is federal health insurance, mainly for people 65 and older, split into 4 parts, and almost nobody explains how they actually connect. Part A and Part B together are called Original Medicare. Part C is a private alternative to Original Medicare, and Part D is prescription drug coverage. Medicare was created back in 1965, and while the core structure hasn't changed much since, the costs and rules around it update every single year. Get the sequence wrong, and that's exactly where the expensive mistake happens. So, let's go part by part. Part A is hospital insurance. It covers inpatient hospital stays, skilled nursing facility care, hospice, and some home health care. Here's what most people don't expect. If you or your spouse worked at least 10 years, 40 quarters, paying Medicare taxes, Part A is premium-free. Between 30 and 39 quarters, you'll pay $311 a month in 2026. Fewer than 30 quarters, and it jumps to $565 a month. A free premium doesn't mean free care. In 2026, the Part A deductible is $1,736. And that's not annual. It's per benefit period. A benefit period starts when you're admitted and ends after 60 consecutive days out of care. Get admitted twice in 1 year, more than 60 days apart, and you pay that deductible twice. Skilled nursing care adds another layer. Your first 20 days are fully covered, but from day 21 to day 100, you pay $217 a day in 2026. And after day 100, Medicare stops paying for that benefit period entirely. Hospice care, by contrast, is covered with little to no cost, as long as it's through a Medicare-approved hospice program. Part B is medical insurance. Doctor visits, outpatient care, preventive services, and durable medical equipment. It also covers an annual wellness visit and a long list of preventive screenings at no cost to you, things like mammograms, colonoscopies, and diabetes screenings. Almost everyone pays a monthly premium for this one. In 2026, the standard premium is $202.90 a month, but it's not fixed. It's based on your income from 2 years prior. Cross $109,000 as an individual or $218,000 as a couple in 2026, and an extra surcharge called IRMA gets added on top, and it climbs through several higher brackets the more you earn. If your income is limited, Medicare savings programs can help cover your Part B premium entirely, so it's worth checking if you qualify rather than assuming you don't. Part B also comes with an annual deductible, $283 in 2026. After that, you're typically responsible for 20% of the cost of most services, with no cap on how high that 20% can add up in a bad year. Picture a hospitalization and surgery totaling $50,000 in Part B, covered outpatient services in a single year. Your 20% share alone is $10,000, with no ceiling. That uncapped exposure is exactly why Part C and D exist, and it's also where a lot of people start making decisions they don't fully understand. Part C, Medicare Advantage, isn't an add-on. It's a different path entirely. Instead of Original Medicare, you enroll in a private plan approved by Medicare, usually structured as an HMO or a PPO. HMO plans generally require you to stay in-network and get referrals for specialists. PPO plans give you more flexibility to go out of network, usually at a higher cost. These plans must cover everything Original Medicare covers, and most bundle in drug coverage, plus extras like dental, vision, or hearing. Unlike Original Medicare's uncapped 20% exposure, Medicare Advantage plans are required to have an annual out-of-pocket maximum, which caps your worst-case year cost. Every plan also carries a star rating from 1 to 5, based on quality and member satisfaction, worth checking before you enroll. The trade-off for the lower monthly costs is less flexibility in who you can see, and plans can change their networks and costs every single year. Part D is prescription drug coverage through private insurers, organized into tiers. Generic drugs cost the least, specialty drugs cost the most. And here's a genuinely good update for 2026. The out-of-pocket cap for covered drugs is now $2,100 a year, up from $2,000 in 2025. Once you hit that cap, your plan covers 100% of covered drug costs for the rest of the year. And the old coverage gap, the donut hole, is gone for good as of 2025. There's also an extra help program for people with limited income and resources, which can reduce or eliminate your Part D premium and drug costs entirely. But if you're on original Medicare and don't have other creditable drug coverage, when you sign up for Part D, matters enormously, and this is where we get to the mistake. Before we get to that mistake, let's clear up 3 things people assume about Medicare that just aren't true. First, Medicare doesn't automatically cover routine dental, vision, or hearing aids. You'd need a separate Medicare Advantage plan or pay out of pocket for most of that care. Second, Medicare doesn't cover long-term custodial care in a nursing home. That's a completely different program, Medicaid, with its own income and asset rules. Third, turning 65 doesn't mean you're automatically enrolled. If you're not already collecting Social Security benefits, you generally have to sign yourself up. That last one is exactly how people end up in the situation we're about to walk through. Here's the scenario. Let's call her Susan. Susan turned 65, was still covered under her spouse's retiree plan that wasn't considered creditable Medicare equivalent coverage and didn't realize she needed to act. 3 years passed before she enrolled in Part B and Part D. Here's what that actually costs her, permanently. The Part B penalty is 10% of the standard premium for every full 12-month period you delay. 3 years late means 3 full 12-month periods, a 30% penalty. 30% of $202.90 is $60.87, added to her premium every single month for as long as she has Part B. The Part D penalty works differently. It's 1% of what's called the National Base Beneficiary Premium for every month you went without coverage. In 2026, that base is $38.99. 36 months late is a 36% penalty, about $14 a month, rounded to the nearest 10 cents, added to her Part D premium indefinitely. Add those together, $60.87 plus $14 is roughly $75 extra every month for life. Over 20 years of retirement, that's nearly $18,000. Not a fine, not a one-time fee, just money quietly leaving her account every month. Now compare that to John, who worked past 65 with a genuinely creditable employer plan and enrolled in Medicare the month his employer coverage ended. Same age, same system, 0 penalty because he confirmed his coverage qualified before he needed to act. Here's how to actually avoid it, and there's more than one window, so let's cover all of them. Your initial enrollment period is 7 months, 3 months before your 65th birthday, the month of, and 3 months after. If you're still working with genuinely creditable coverage, you get a special enrollment period, typically 8 months after that employer coverage ends. To sign up, penalty-free. Miss both of those, and you're stuck waiting for the general enrollment period, January through March, with coverage often starting the month after you enroll. Already have Medicare Advantage and want to switch? That's a separate window, January 1st through March 31st every year. And every fall, October 15th through December 7th, is open enrollment, when anyone can switch between original Medicare, Medicare Advantage, and Part D plans for the following year. If you're not certain your current coverage counts as creditable, that's a phone call worth making before a window closes, not after. Let's bring it all together. Part A, hospital coverage, usually free if you've worked and paid Medicare taxes, with costs that reset per benefit period. Part B, medical coverage, a monthly premium based on your income and uncapped 20% exposure. Part C, Medicare Advantage, a private bundled alternative with a built-in annual out-of-pocket cap. And Part D, prescription coverage, now with a $2,100 annual cap. but a penalty that compounds for every month you delay without other creditable coverage. Choosing between original Medicare with a supplement or a Medicare Advantage plan comes down to your health needs, your budget, and which doctors you're not willing to give up. That's exactly what we're breaking down next. Medicare Advantage versus Medigap, side by side, so you can see which one actually fits your situation. Subscribe so you don't miss it. And if this cleared up something that's been confusing you, tell me in the comments what you want explained next.